Happy New Year, everyone, and welcome to a brand spanking new episode of Focus on Your Health. I am Rose, your host, and today on Focus on Your Health, we are going to focus on prenatal care in honor of National Birth Defect Awareness Month, which falls in January. So, what is prenatal care, and why is it important to us? Prenatal care is very important to help make sure that you and your baby will be as healthy as possible. So, what will happen during your first prenatal visit? After you find out that you are pregnant, you should make an appointment with your doctor. Your first prenatal visit will likely be when you are 6 to 8 weeks pregnant. Your doctor will probably start by talking to you about your medical history and how you have been feeling. You will be weighed and your blood pressure will be taken. These measurements will most likely be taken during each doctor's visit for a parameter. On your first visit, you will also have a pelvic exam to check the size and shape of your uterus or womb, and a pap smear to check for any abnormalities of the cervix, which is the opening of the uterus. Urine and blood test samples will be taken on the first visit, again later at a later visit, such as your first, second, and third trimester. Other tests are performed, such as a urine test to check for bacteria in your urine, high sugar levels, which can be signs of diabetes, and high protein levels, which can put you at risk for preeclampsia. It is a type of high blood pressure during pregnancy. Blood tests to check for low iron levels, such as anemia, blood cell count, infectious disease, and blood type will also be performed. Sometime an ultrasound may be done to help figure out when your baby is due or to check for your baby's growth and position in the uterus. Other tests may be needed if you or your baby are at risk for any problem, indicating from your family history. What should you eat during your pregnancy? Well, eating a well-balanced diet is one of the most important things you can do for yourself and for your baby. But be careful of any fish that is very high in mercury, such as tuna and shark fish. It is best to start taking folic acid and also prenatal vitamins during your pregnancy that your doctor prescribed. Do not take any medication that the doctor is not aware of or has prescribed to you. So that's very important to remember. Also, remember, folks, to call your doctor if you have any of these symptoms, such as blood or fluid coming from your vagina, sudden or extreme swelling of your face, fingers, and feet, headaches that are severe and will not go away, any increased nausea or vomiting that does not go away, dizziness, blurred vision, pain or cramps in your lower abdomen, chills or fever, any changes in your baby's movement, such as the baby's not moving at all or moving too much, less urine or burning when you are urinating, any illness or infection, anything that bothers you, you need to call your doctor and have him answer your question. Here are some of the things that you should avoid during your pregnancy. Don't smoke. Don't use drugs such as cocaine, heroin, or marijuana. Don't drink alcohol. Don't clean your cat's litter or eat raw uncooked meat such as red meat. Don't sit in a sauna or a hot tub. And try not to douche. These things can put you at very high risk for miscarriage or birth defects in your baby. Continue going to your scheduled doctor visit remember, folks, by not getting your prenatal care may put you and your baby at risk for any abnormalities in the baby, at risk for birth defects and poor health. We are going to show you right now, this is very important, that we are going to show you some pictures of children that was born with some birth defects that could have been prevented by the mother's going and receiving prenatal care. This is basically to inform you of how important it is that you actually receive prenatal care while you are pregnant. And if you find out you may be pregnant or want to have a baby, this is the best time to do so, to go ahead and start taking care of yourself to be ready for your baby. In conclusion, if you are planning on starting a family and having a baby, it's never too late to start taking care of yourself. And also, if you find out that you are pregnant, get together with your doctor, give your doctor a call, and start right away on that prenatal care, because the end result of that will be a happy and very healthy mother and baby. So for 2011, we want you guys to stay focused and stay healthy. See you next time.
And there you have it.